Now this video is demonstrate the passive manual mobilization for the shoulder joint, mainly for the glenohumeral joint. Accessory movement refer to the small amount of non-physiological movement, like anterior to posterior glide, AP, posterior to anterior glide, less common than AP, inferior glide, very common. Superior glide, gliding upwards is relatively uncommon in the shoulder because usually they have already excessive translation. Very seldom we do superior. Okay, for this accessory movement in undergrad we do in the neutral position and a test, but in a clinical trial we usually do the end of the range of physiological movement when they have restriction or they have pain. We want to relieve the pain. Okay. For example, when do the anterior posterior translation, normally when we have the limited restricted AP or PA movement doing external and internal rotation, we do that. So we can open our hand and do the anterior posterior movement. Okay. Or if posterior anterior, we can do it this way, but you'll find the scapula ring out. Okay, so that's why sometimes if the restricted movement, we hold here, then you do it posterior to anterior. But this one is less common than the AP. Okay, distraction is rather common after, especially the case frozen shoulder. After the mobilization, the patient feel much pain. Then we do the distraction here to temporarily relieve the pain. Use two hands, use the body, use my whole body to move out. Instead of using my hand, it's very tiring. Use my whole body, it's very easy control. Go into the restricted flexion. For example, in here, in a restricted flexion, either sometimes, mostly I need to do some inferior glide or distraction to loosen up. I will do it this way. Hold the arm here. This is the inferior glide. We do it this way to further loosen up. So after that, I can go further for the flexion position. For the AB reduction, still the same. If I go to AB reduction, if I here I want to add some accessory movement, I also use my hand to do the either inferior glide or distraction in this direction, distraction or inferior glide. Even anterior posterior glide also get applied. It's not necessary that the restriction is from particular direction, case by case basis. So you need to feel which direction is blocked. Then we do the accessory movement accordingly. Okay, so those are the passive accessory movement mobilization demonstration.